doctor. So today we wanted to discuss with you regarding the risk adjustment forum 2024 and how your experience at the RISE conference was, and what are some of the major highlights that you would like to talk about?
Sure. I thought the conference was great. It's always great. Really appreciate Rise's work to get new speakers and always bring the most cutting edge on everybody's mind, front of mind content. So I thought it was a great conference. Never long enough because there's just so much to learn. I thought that there was a good balance between things that were that would be important to someone who's relatively new to the space, as well as folks that are more senior and looking for, content around how to improve their program. I think the emphasis this year was really around V28 and what people are doing in response to that. And so knowing that there's a lot of changes to the risk model and what that means for the industry. There was a lot of talk around and some of my favorite topics, but a lot of talk around technology. The understanding that with V28, more technology, more cutting edge technology needs to be brought to bear in really understanding and getting to know and manage that patient, and especially bringing that information point of care. I think one of the things that we recognize and that I heard at the conference is that, there's not a lot of time, even though we have our sweeps periods, and folks, think that gives them time to work and process data. It's really not a lot of time. I mean, ideally, we have a paradigm shift and we're really focused on caring for the patient in that time, so that you can have some effect. And so bringing that data to be there at the point of care and even to use it either concurrently or prospectively, that there's an emphasis. And so, managing that patient or better managing that patient. And then with that said, there was a lot of recognition and talk around total cost of care. And so when we think about just doing well at managed care, it's not just about risk adjustment. You have to take into consideration, the quality measures, not only from a performance standpoint, as far as, you did well and you're going to get your check the boxes, if you will, on your contracts, but also to just making sure that patients are taken care of. But the other piece of that, and I think, that's one of the things with V28 is that margins are compressed. They're much smaller. And so, what else can you do to offset where you're not expecting that risk revenue any longer, and where it should have always been, right, is on total cost of care. So making sure that patients are, getting care at the right place of service with the right provider. You're not jumping to a specialist or an MRI without first doing, other types of things that would be appropriate in the treatment and care of that patient. And so a lot of focus there. There was also a lot of talk around, concerns around audits, RADV, what OIG had to say. OIG was present and spoke as well, which those sessions I always enjoy because I think that gives you some insight into, if you're not already preparing where you need to be. And one of the takeaways that I got there was that, again, if it's managed care, your patient should be managed. And so looking for things like codes that would be inappropriate, say in an ambulatory setting, or only seeing a code once in a record. If you have a diabetic patient and you only have one encounter for them and the diagnosis of diabetes only showing up once in the record, that's concerning. And so how can you bring the various parts of your program, or even begin parts of your program, add to your program, to ensure, again, that patients are being managed well. And so that they're getting into their physicians, that they're, being seen for what they need to be seen for, that they're closing their quality gaps, and that they're conditions, particularly their chronic conditions, are being monitored and documented, and that the level of care that would be appropriate for those conditions is evidenced in the record. Were all important, and things that I heard at the recent conference.
Thank you so much, Doctor. As you said, there was a lot of talk on technology. Were there any points or in the conference where you got to see and learn how the AI in risk adjustment is happening, or if there are any advices that you have for the companies that want to adopt AI into risk adjustment? What are some of the things that they should be looking after?
Yeah, absolutely. I really appreciate the opportunity to attend these conferences because I feel like, I'm learning along with the other attendees too. And one of the things that I think I've learned in the last couple of conferences, but it was further enforced or reinforced, I should say, and carried further was the concepts or how can I put this? What's necessary for good AI. A year ago, you could walk through the exhibit hall and everyone was touting that they were doing AI. And it was like, well, what does that mean? And as a discriminant buyer, how do you really make the determination around whose AI is better? Because if everybody's doing it, it doesn't seem like there's much differentiation, right? You wouldn't necessarily be able to determine, you could just pick anyone, and then your, decision factors would be price or convenience. But I feel like attending these conferences, I've definitely had an opportunity to learn more and be more of that discerning or discriminate buyer of AI. And so some things that I'm paying attention to now are, the ability to take in data. There's definitely something to be said. Not all data is created the same. And so not everything is standardized yet. And even though you may be on the same EMR system, it's still not the same system. And so it could be set up differently. It maybe doesn't have, all the pieces or the components. It's a different version. And so there's definitely some differences. And so working with someone that knows how to take in standard, non-standard data, quantitative, and not all quantitative is the same, right? And qualitative data, but really able to make sense of it is important. And there will be a lot of people that tell you that they can do that. But I would say, spend some time talking to their other clients, and then also to, taking a look at some of the models and some of the things, some of the output that they've been able to produce, maybe even doing, some sample data and taking a look at what they're able to do. Because I've definitely seen some differences there. I think not only in interpreting data, and again, not just standard, but that non-standard data, but also, how they're identifying your members, how they're categorizing or cataloging them, what the hierarchy is for provider attribution. And so these are all things that for me would be important to take a look at, and how flexible they are in their model. Because if it's very rigid, we know that healthcare data doesn't work that way. And so you want something that's more pliable, and you want an organization or a team that's going to work with you. And I think having people that are part of that organization that are, very knowledgeable. It's one thing to talk to the salesperson, and nothing against my salespeople out there, but really understanding the mind behind the data. And I think that while it's important, to have that data scientific, perspective, it's also important to have that clinical perspective. And I've often found in my 20 years now, or over 20 years of working in healthcare, what I call the gap and minding the gap. You really need someone who understands the technology piece, as well as the clinical piece, and then be able to, to bridge that. The other thing that I would say would be important about AI and using technology is understanding what the foundational model is. And what I mean by that is, the data that they're running against. What are all the data sources that they're bringing to bear, say, to train their model, to understand who are suspects? If you're working off of data that is anesthetized and maybe more generic, you're not going to get um, those specific insights. I've worked with a few systems. I work with a lot of folks across the country, including risk-bearing provider groups and health plans. And I've seen systems that they use. And some of those systems, um, some of them are great, but some I've seen where the insights are not very targeted or they've missed some things where we're still needing, coders and others to go in and review the records. Not that you won't always need that, but I would think that if you're looking for systems that are based on they have that good foundation and a well-trained model, and they're constantly updating it, and feeding it data and training it, fine-tuning it. I think that, again, that's important, because otherwise you run the risk of missing things or having things presented that are inaccurate. And so anyway, so those are the things that I would pay attention to. Again, making sure that you have a good foundational model, that they're training, their AI on, and that they're constantly updating it too. That you have knowledgeable people within the organization that really can speak the clinical as well as the technical sides equally well. And then, three would be being able to manage multiple, disparate data sources, because we know even in the standard data, I don't think that there's any standard. And so those are the things that I've learned over, I would say, the last year or so, that would be important to anyone who's considering any tool where it's said that they use AI.
Thank you, Doctor, for the very insightful details. And I also do believe that training is really important and also constantly updating your AI.
Yeah.
Working in an AI organization, I've also seen that it's a daily update. You need to continuously tell it, remove any hallucinations, work on any hallucinations. So I know I completely agree with you on this. So my next question is actually a shift from this conversation to the panel that you were a part of, and from our team, Dr. Shardul Mehta was a part of. That is on evaluating updates to accountable care organizations, ACOs. And I wanted to check with you how your experience was and what were some of the main things that you learned, and if it was highlighted in the conversation that how technology is a pivotal force in adapting to evolving healthcare landscape and ensuring ACOs remain efficient and effective in delivering value-based care.
Great question, and a very big one. But I learned a lot. I learned a lot and really enjoyed. I know, as you said, Dr. Mehta participated, as well as Adrian White and Susan Waterman, and both a wealth of knowledge. I think one of the things that we talked about, we talked about a few things. There's different ACOs, so different ACO structures. And I know one of the things that I wanted to make sure came across to the audience, and I think we did a good job at this, was, sometimes people throw their hands up and say, well, why do I have to pay attention to this? I'm interested in Medicare Advantage and, risk adjustment in that way. And it's like, you need to be paying attention to all the new models that are being introduced, because really, not only are ACOs often associated with, and we could get into the particulars there, but not only are ACOs associated oftentimes with either health plans or other businesses. There's like I said, there's other types of ACOs, and so they're risk bearing too. And so I think that they provide pressure on the MA programs that are out there. And so you might start seeing, in fact, I think we're already seeing more diversification into what a risk bearing contract can look like. and ACOs, right? And the various types of ACOs, whether it be ACO REACH, MSSP, or if it's, the primary care flex model. So there's these different models and different structures. But again, risk-bearing and putting pressure on Medicare Advantage programs, because you're vying, right, for the same population and the same physicians that are treating those various patients. One of the things that I thought was important that was brought out, so a few things. We know that ACO models are now based on V28. They're subject to the same phase-in that Medicare Advantage is. One of the nuances is, though, while the claims manual will permit you to submit claims up to a year since the date of service. So say if a patient goes into the physician today, that physician has a year from this date of service to submit that claim. But there are rules built into when the data on that encounter or on that claim is available for risk calculation for the risk score. And so it's a much shorter window than what it is for Medicare Advantage. For ACO REACH, the submission period for last year, 2023, was closed off in March of 2024. And so there are different sweeps periods that it's subject to. And why I think that that's important to note is not only so that you're aware of how it may impact your revenue, but it also then drives your programs. And I think it just, it begs the issue that we need to have things much more timely. And I think that, these ACO arrangements are pushing that more and more because, again, it's population-based risk. And it's typically thought of as less revenue than on MA, right, where it's calculated as an individual. You have those shorter windows, but you're still responsible for managing those patients. And so having data timely. And so we talked a lot about, not only just the regular programs of making sure that, you're seeing your patients, you have complete documentation, that you're, making sure that they're getting all their quality measures closed, and attending to all of that. But we also talked about, total cost of care. And so making sure that the patients are coordinated, that, referrals to specialists are connected. How are your care management teams involved? Very important for your patients that have, multiple chronic conditions that they need managed. And then how are you getting that real-time information? So again, that sensitivity and that importance of having accurate data at the point of care or even prospectively before physicians are seeing that patient, so that, again, you have that intricate, story and history of that patient that's going to be important and be brought to bear on any treatment or care that they might require. So I thought that, those were important pieces or facets that came out of our panel discussion, again, around timing, around having accurate data, and all of that, of course, required technology. And so, what technology are you bringing to bear? How are you using AI? And just like technology and AI are going to be important in healthcare overall, it's going to be very, very important in managed care, very, very important in Medicare Advantage. And I think even more so, doubly so, in these ACO arrangements, just because, around the timing, maybe the looser affiliation with physicians that ACOs have. So yeah, so great panel. Thought that there were a lot of really astute and great points, and really enjoyed getting to speak with such informed leaders. And then of course also to the added contribution of Dr. Mehta in both his clinical and technical knowledge. I thought made that panel just an exceptional one. A great way to kick off the morning of day 2.
Great. Thank you so much, Doctor. And even Dr. Mehta really enjoyed the conference.
Awesome.
Yes. So, if there is anything else that you would like us to know, and if there's anything else you want to highlight, would love to hear it from the conference.
Yeah, I can't think of anything. I think, like I said, always a great conference. Always look forward to the agenda. I think that if you haven't been, you should go. And if you've been, make sure that you take a tour through the exhibit hall. And I don't just say that because, I want you to go see anyone in particular. But I think one of the things that I've learned over the years as a leader, in the early days, I walked through the exhibit hall head down and I was afraid, because somebody was going to try to sell me something. And I promise you, no one will lock you down. No offense to timeshare people, but it's not like they're going to lock you in the room and force you to buy something. But I think it's important to visit the different booths to hear what people are doing, because that's one way, right, that you stay up to date and get to know what technology is out there. And it may not be something that you use in your role today, but it may be something that you might need at a future date. And so, in addition to attending the sessions, I think that it's equally important to make sure that you visit the vendor booths, network, get to know people. And, I think everyone should attend at least one, if not two conferences a year, more if you can. But it's just always good to stay up to date. And I think it's difficult to do it in a vacuum. So to the extent that, we're in isolation, so to the extent that you can get to one of these events, mingle, visit your vendors, attend your sessions and network, I think will go a long way to contributing to your organization and contributing to your knowledge so that you can continue to be a person of value for your organization.
Thank you. That was really great advice.